Welcome back to your channel name. Today, we're diving into a critical issue in diabetes care that's been flying under the radar, the misdiagnosis of latent autoimmune diabetes in adults, or LADA. If you or someone you know has struggled with diabetes management, this episode could shed light on why the right diagnosis matters and how systemic biases may be affecting care. Let's get started. When Phyllisa Deroze was first diagnosed with diabetes, she received pamphlets with images of children and seniors. At just 31, she was handed the one with seniors. But her story is a stark reminder that diabetes doesn't fit into neat categories. In fact, many people diagnosed with type 2 diabetes might actually have LADA, a form of diabetes that doesn't always follow the expected path. Phylisa's journey is a powerful example. For 8 years, she managed her condition under the assumption it was type 2 diabetes. It wasn't until a serious health crisis that she discovered she actually had LADA. This type of diabetes, often misdiagnosed as type 2, can delay appropriate treatment and lead to complications. Similarly, Mila Clarke, a diabetes advocate, struggled with management despite adhering to diet and medication. It was only after switching doctors and pressing for antibody tests that she learned she had LADA. Her experience highlights a crucial issue. Systemic biases in healthcare may contribute to misdiagnoses, especially among marginalized groups. So, what exactly is LADA? Latent autoimmune diabetes in adults is a condition where the immune system attacks insulin-producing cells, similar to type 1 diabetes. Unlike type 1, it often develops in adults over 30 and doesn't immediately require insulin, but like type 1, it eventually leads to a need for insulin therapy. Dr. Jason Gaglia from the Joslin Diabetes Center notes that as many as 10% of people diagnosed with type 2 diabetes might actually have LADA. The problem? LADA progresses slowly, and its symptoms can be mistaken for type 2 diabetes, especially in patients who are overweight or have a family history of type 2. Here's where it gets even more complicated: systemic biases. Rochelle Naylor, a pediatric endocrinologist, points out that implicit biases in healthcare can lead to misdiagnoses, particularly among Black patients and other minoritized groups. For example, healthcare providers might unconsciously assume that a patient with a certain body type or racial background is more likely to have type 2 diabetes, overlooking LADA. One crucial step in addressing this issue is improving testing practices. Although tests for type 1 diabetes antibodies can help distinguish LADA from type 2, they're not always used. Dr. Kathleen Wine from Ohio State University advocates for broader testing, arguing that it could prevent severe complications like diabetic ketoacidosis by catching LADA earlier. Phyllisa Deroze's struggle to get the right diagnosis illustrates another problem: the feeling of being unseen by the healthcare system. Despite her qualifications and knowledge, her race and weight influenced how her condition was perceived. It's a stark reminder that patients' voices and experiences must be validated and heard. So, what can we do to address these issues? First, advocate for better diagnostic practices and support efforts to reduce bias in healthcare. If you or someone you know is struggling with diabetes, don't hesitate to seek a second opinion or request specific tests. Awareness and self-advocacy are key. Thanks for tuning in to your channel name. If you found this video informative, make sure to like, share, and subscribe. And join the conversation using our hashtag #DiabetesDiagnosisTruth. Share your stories or thoughts, and let's work together to ensure everyone gets the care they need. See you next time. Fade out.